Let's talk about that report from the HSE on schools. We're joined by Dr. Abigail Collins, the HSE's Public Health Schools Response Lead. Abigail, just start, if you will, by running us through the findings of your report.
Hi, thanks very much for having me on. This was just a report really that was written by the Public Health Schools teams, which is a synthesis of all the data that has been sort of presented on a weekly basis across the course of the school year. And I suppose really it just sort of summarises the information that across the school year, despite the sort of peaks and troughs in the numbers of cases that we had and the different variants, etc., that really the position was that schools with the right mitigation measures in place remained low-risk environments for staff and students, which is great. That, really across the year, the close contact positivity that we saw across the schools was 2.36%, so very low compared with other settings. And that's really sort of reflected with international data that with measures in place, schools can be low-risk settings for children, which is great news going into a new academic year, I suppose.
The other interesting finding, I thought, particularly in relation to, may come as a reassurance to the teaching unions, the level of child to adult transmission was very small.
Yeah, anecdotally, really across the teams, what they were finding was that when a staff member had an infection and was symptomatic and on site, so it really was symptomatic people where we tended to find more close contacts who were positive. So that's the first really important thing, that if you have symptoms, be precautionary, stay away and discuss with your GP. But really it was when adults had symptoms that they might spread more to other adult colleagues, for example, in the staff room, etc., or when they're working closely with children. But actually, in that setting and amongst most settings, as we know with children, for whatever reason, they're not great at passing on this virus. A little bit better at home with the close intensity of contact with their parents, for example, but within the setting of the schools, that it was much less likely to occur that way around, which again, as you say, is reassuring for the staff members who at this point are largely vaccinated. As you were just saying there's a very high rate of vaccination, and we obviously encourage that, and it's fantastic that the Irish people have taken to the vaccine.
The issue of outbreaks as well. Again, there's been a bit of a myth that schools were breeding grounds and there was loads of outbreaks, and I suppose the ones that did occur were highlighted, but actually your report found that they were usually of a small scale, such outbreaks.
Yeah, that's right. Obviously, outbreaks occurred and we regularly talked about them, and larger profile ones, I suppose we often went and discussed as part of our concerns within the media. But by and large, the outbreaks that we saw were, at the level of 2 to 4 linked cases to those outbreaks. So they were small and they tended to be amongst friendship groups. So, if we were concerned that it could be the school, we are sort of negative, pessimistic, and we reported as school transmission. But obviously people travel together and there were friendship groups and play dates, etc. But, the outbreaks that we did see, 50% of them were at the level of 2 to 4 close contacts who might be onward positive. We did see larger ones, as I said, but much of those have been discussed, and they had, many more kind of complicated other issues within the community as well. Okay,
let's just close by just looking at your recommendations. Schools should seek to reopen as a high priority. There's no reason not to reopen schools based on this survey.
Yeah, and this is a report of the data that we found rather than a survey. So it's presenting the national data, and absolutely, the schools by the WHO are a very high priority and should be the first places to open and the last places to close because of the importance of children. So absolutely, there's nothing that we've seen over the last academic year, nor actually over the summer in the context of Delta with the childcare facilities, and that would change that recommendation.
You didn't make a recommendation, and maybe it wasn't your remit, in relation to antigen testing. I know I have friends in the UK who, I think they do 2 antigen tests a week at home before their kids go into school. You didn't make a recommendation in relation to that?
No, one that's not within our remit. I suppose that was, we were looking at the data that we have. But I suppose secondly, there's 2 things. There's antigen testing for a query, sort of a diagnosis, which is absolutely fine. And then there's antigen testing for asymptomatic screening, which screening is always a slightly, a controversial issue. You need to consider the sort of the pluses and the minuses. So, that has been discussed a lot in Ireland, and I'm sure will continue to be discussed to some degree. But the evidence from the UK is that only about 25 to 30% of people in the school setting were actually doing it and uploading the results. That it's not particularly pleasant for children, particularly to be undertaking. And that I suppose also, the reason you're doing it is to stop the spread and the scale of outbreaks. So you want to reduce number of outbreaks and a smaller scale. And we weren't seeing large numbers of those anyway. And there's no evidence from the UK that actually they were really impacting on that. So it needs good consideration while you're asking people to do it.
All right, Dr. Abigail Collins, the HSE's Public Health Schools Response Lead, with that fascinating report, fascinating data. And look, Mark, let's not hear any more stuff and nonsense about schools shouldn't reopen in September. There is no reason why schools should not reopen. I think it's later this week, in fact. It needs to happen.